analytical, ethical, investigative, calm, and that you listen to your patients. And Tishaura just shared that she's had a wonderful experience with you as well. So I thank you for being here with us.
It is
Next,
an honor to be here.
next we have Angela Fleming Brown. Angela leads an ambitious charge with the St. Louis Regional Health Commission. Prior to joining the commission, Angela was the Health Initiative Director for Interfaith Partnership Faith Beyond Walls, where she worked with African American churches to develop health ministries and implement health programs to improve the health outcomes of their congregations. So you'll be speaking more in depthly with us about the St. Louis Regional Health Commission's charge and some community initiatives. And then we have Tishaura Jones, our treasurer. Tishaura brings a deep personal commitment, a wealth of experience, and a proven record of leadership to serving the city of St. Louis. Her political career began in 2002 when she was appointed as Democratic Committee Woman of the 8th Ward in the city of St. Louis. She has recently served for 2 terms in the Missouri. Oh, no, this is a bit dated, but I do see here that you were the first African American and the first woman to hold the position in Missouri history for the, let's see, the Assistant Minority Floor Leader. Wow. So Dr. Boykins, your picture behind you speaks to all of our panelists. That's a wonderful tribute and very reflective of the type of talent and commitment we have here. So what I'd like to do is to make this quite conversational. We'll also look to engage our guests on Facebook and to learn more about how we can gather more information and disseminate it in a timely manner to the communities that need it most. So Dr. Boykin-Wright, if we can start with you.
Okay, so I was asked to mention a little bit about my mission, and I took the time to go to the webpage of the place where I work, People's Health Centers. I'm actually in my second stint at People's Health Centers. I have a 27-year career in medicine, and literally half of my career has been spent working in community health centers. And my first experience with People's Health Centers was in 1996. And I worked there for 4 years, and I left to go into private practice where I stayed another 13 years. Well, when I left private practice, I knew I always wanted to find my way back to somewhere like People's Health Centers because I really embraced the mission of the health centers. I'm going to quickly read what our website says our mission is, which is very aligned with my personal mission. So the mission of the health center is to provide comprehensive primary health care to meet the needs of the entire community in St. Louis. People's Health Center is committed to serving the impoverished and underserved populations in St. Louis City and County. The one nice thing about working in a community health center is that I have resources. I have resources of social workers. I have other specialties, other primary care specialties, pediatricians, OBGYNs. We have dental, we have podiatrists, and we can really give wraparound services to those in the community. And it provides an opportunity that you don't always have when you're in a private practice setting where you can't reach out and say, hey, my patient needs to be enrolled in a patient assistance program because they can't afford their medication. Or, hey, I need a social worker to help this patient with their mental health issues. We want to try and bridge them to get some mental health support. We've recently offered COVID testing. We began COVID testing a few weeks ago now, and we'll be doing COVID testing at least once a week at our North site. And from what I'm hearing from our CEO is there are plans for us to expand our COVID testing in the St. Louis area and to provide a mobile COVID testing unit to provide services to other parts of St. Louis City. So my approach to solving our COVID, and it's not, of course, we can't solve this. This is an ever evolving problem, but the nice thing is that it encourages us to go back and embrace our own health care. And I think it all goes back to how are we approaching healthcare? How are we accessing healthcare? And this has made people a little bit more cognizant of the need to maybe have a relationship with their healthcare provider. It's making people think about how to access healthcare. We don't want to run to the emergency room all the time. We want to try and find that person who we have a relationship with so that we can make things happen for ourselves and for our families. I don't want to go on too long, but that's just a sort of in a nutshell.
Yeah, that's a great service, a much needed service. And thank you. Angela, can we hear more about your initiatives and your work in the community?
Yes, thank you. As she mentioned, I am Angela Brown, the Chief Executive Officer for the St. Louis Regional Health Commission. And we are a nonprofit organization that works to ensure people who live in St. Louis City and County that are uninsured have access to healthcare services. And so one of the programs that we have for this is called Gateway to Better Health, which we partner with BJK People's Health Center. So Dr. Boykin-Wright is definitely a part of that network and that service that we offer. But for those who are uninsured, they have access to healthcare. We pay for primary, specialty care, and urgent care services through that program. In response to COVID, one of the things that we wanted to ensure was that those uninsured and underserved populations that we work to support had access to treatment as well as testing. And so we started an emergency fund in March, and we were able to help fund Affinia Healthcare and Care STL, which were the first two healthcare centers that offered testing in North St. Louis. And so we helped get those places started. We've also helped support telehealth for behavioral health for Hopewell, which is a sister organization of BJK Peoples, and then also Casa de Salud and some of their telehealth services for their immigrant populations. In addition to that, one of the key things that we knew was communications and making sure that our underserved and under-resourced populations had information that they needed. And understanding that when this first, I think back at the beginning of April, the disparity that we saw in our African-American populations with the impact of COVID, and wanted to make sure that they had the necessary information as well as tools to be prepared to not only stop the spread of COVID-19, but also to survive the shelter-in-place order. And so we started a campaign called Prepare STL. You can definitely find more information about it at preparestl.com. But it is a communications campaign and that's targeted towards our people of color, specifically the African-American communities, immigrant and new American populations. And it's information to get out to talk about how to stop the spread, understanding that many people of color are not able to shelter in place because they are essential workers. They work at your grocery stores, restaurants, and places that were still open. So making sure they had the right protective equipment, social distancing, and other needs that they might address in this time. And then also connection to those resources for those who may have lost jobs, need help with utilities and assistance, and how to connect people to 211 and other services. In addition to that communication strategy, which was television, radio, and other social media and other types of media, we did an outreach campaign, which was led by individuals who live in these communities that we call community health workers or community consultants. So thanks to many of our partner organizations like the St. Louis Integrated Health Network and Alive and Well Communities, who have these infrastructures of people who live, work in these communities, their neighbors that they were passionate about and wanted to make sure they had the appropriate information, went out to many of the places that were still open, like the grocery stores, the gas stations, and other businesses that were considered essential during this time, and posted up literature, yard signs, and other materials just to make sure that the information was available in those communities. And one of the first things that they noticed was many of the workers, although they may have sold face masks and other protective equipment, they didn't have them. As well as people who were shopping, they did not have the right protections, the masks. And if they had the masks, they weren't wearing them appropriately. So Dr. Punch, who we work with a lot, likes to call it they're sagging their masks. So kind of the next phase of our work is looking at how to wear the mask and other PPE appropriately. And so really helping to get that information out to our communities. And so we've been doing that. And as we begin the reopening of our city, we are shifting in a lot of our communications to emphasize that, we're walking into this new normal. This is still an urgent and important issue that we should all pay attention to. And we definitely need to be wearing our masks and social distancing. And so we do have campaigns to give away masks. We're trying to get cloth masks now because we understand this is a long-term challenge that we'll face for our community. We want people to have these protections long-term. And so we're doing some work to get that out. And then the last thing that we did to help address this issue was look at policy changes that need to be in place. So we're definitely advocating for Medicaid expansion because we understand that insurance would have helped a lot of these populations had we had access to healthcare coverage. Funding for our health centers and our hospitals, as many of them saw reduced utilization of services that caused budget concerns for them. And so they definitely need the appropriate funds to ensure they're able to stay open and operate during this time. And then a big need and push for racial equity. I think as we look, this disease has definitely highlighted the need to have a focus in that space of understanding people of color and need to not to have them at the table in terms of making decisions and policy actions. And so really pushing that agenda as we look forward in the future of COVID-19.
Yeah. Well, I salute you because I have supported some of the work with Prepare STL, and it's just, I mean, phenomenal that it came to be in such a short term. It has been so cumulative and far-reaching. So that's a wonderful resource for us. Tishaura, Treasurer Jones, thank you for joining us. And I asked that you be on in this session because in talking with you, I was impressed that as our treasurer, your reach is so far and it's so broad in how you can help service, be of service to your constituents throughout the city and specifically in underserved and Black communities. So can you speak to what your office is doing in this COVID-19 era to support some of the initiatives? Yeah.
Yes, absolutely. And thank you again for having me. And it's great to see these wonderful Black female panelists here, especially my former doctor, Dr. Boykin-Wright. One of the things the Treasurer's Office does is we have an Office of Financial Empowerment, and also the Treasurer is the parking supervisor. So when this pandemic started, before the city and the county issued orders to shut down, I also shut down parking enforcement and collection of money from meters. Because if you think about parking meters, they can be some pretty dirty surfaces. And the last thing that we wanted was either a parking enforcement officer to catch COVID or any of our staff or any of our citizens to catch it while touching potentially a parking meter that had COVID sitting on the surface, because at the time we didn't know how long it was living on surfaces, and there were reports that it could live on metal surfaces for up to 2 to 3 days. And another reason why I shut that particular division down was the last thing I wanted people to be worried about right at that point was paying a parking meter or paying a parking ticket while trying to go out and feed their family or get things for their family because everybody was just kind of running around a little, rampant at the time. And the other part in the Office of Financial Empowerment that we've been doing is pulling together resources on our website. Just like Angela was saying, we want people to survive this pandemic, not only physically and mentally, but also financially. So we put together a whole host of resources on where to get food from food banks, where to, if you have a child in public schools, where to pick up food there. We were also giving out flyers to during the weekly pickups. And then we also started a web series called Tips with the Treasurer, where we did webinars every Tuesday and Thursday with different topics that ran the gamut, like the SBA assistance. We were one of the first to do a SBA webinar with the other affinity chambers, the Black Chamber, Hispanic, and Bosnian Chambers of Commerce, to make sure that they reached out to their small businesses and had information about the PPP program and the EIDL loan. Then we also did we brought in Legal Services of Eastern Missouri and told people what their rights were if they were renting an apartment and they weren't able to pay their rent. Like what were their rights as a renter? We brought in, we brought them in another week to talk about the unemployment insurance process, how to apply for employment insurance, and how to get that extra up to $600 per week. Then we also brought in someone about if you a person who does mortgages, like if you own your own home, if you were going to take advantage of the forbearance that was being offered and what that process looked like on the beginning and the end of your loan. So we thought it was very important to talk to people about staying financially healthy, about keeping their credit intact, because we don't know what we're going to look like on the opposite end of this. We don't know, how or when our economy is going to rebound, if it ever rebounds to pre-pandemic levels. And we just wanted people to be prepared with as much information as possible.
Well, that was very proactive and very much a resource that was for the whole city versus, segments of our city. So what I'd like to do now is to move into some of the questions that we've received from some of the participants who are some of the registers on our Facebook, because we are doing this Facebook Live, my first time, but if you didn't know. And we're very happy to have the participants from the community and, are taking their lead as to what they want to see, because we believe that they know what's best for themselves, and we want to be a resource in that regard. So one question that we've received is, I'm most concerned about education and how educators and service providers will be prepared to deal with a high volume of kids who in the home environment with abuse, neglect, and worry about COVID-19. Angela, does your agency have any resources to support parents and children who may be in home environments that aren't healthy environments?
So we don't have any direct resources. The main resource we've been referring people to in terms of supports is 211+1, which gets you to BHR, who helps with mental health services and those needs that people may be experiencing, understanding that a lot of individuals are experiencing different stresses and having to cope with different issues that violence, whether it's child abuse and other things. And so they can reach out to those resources where they have licensed professionals who can help provide assistance and connect them with providers that can help them further. And so definitely if they are having those experiences, and one of the things of having shelter in place where it was a relief for a lot of people to go to school and home, to be out of the house away from some of the abuse, and now you're kind of living in it. And so definitely hopefully people, if you are experiencing that, we want to help normalize help and ask for help and reach out. So 211+1 connects you directly to Behavioral Health Response, who is BHR, a crisis hotline that connects you directly with any type of service to help deal with those issues.
I'd also like to remind people about Annie Malone Children and Family Services. Just last weekend, we did a virtual telethon because we didn't have the May Day parade this year, which is their largest, one of their signature fundraisers. And they are still providing services within the community. And one of their staff was, I interviewed one of their staff last week, and they talked about sort of an uptick in calls that they've received about children who are in danger. So that's also a community resource if anyone needs it.
Wonderful.
And I'm just going to tag along with that. But one of the beauties of many of the community health centers, like People's Health Centers, we have several federally qualified health centers in the St. Louis area. We have pediatrics. We also have mental health services that are available through either an arm. We have our Hopewell arm at People's Health Centers, but we have social workers. Many of the community health centers have a social worker on site. And some of the social service workers are even doing, they offer resources for patients who either call in or present to the health center. Many times you can have an encounter with a mental health professional or a social worker who can bridge you to a mental health professional in that health center. Don't be hesitant to reach out to your primary care provider, be it an entity or your provider, physician, nurse practitioner, et cetera, to voice those concerns. They are available. And many of these health centers, what a lot of people forget, whether you're uninsured or you have insurance, many of our large health centers in the St. Louis area, we're fighting to get those lives, to get control of those people. We want those bodies. We want to claim those bodies as, you know, this is someone who we have as part of our healthcare home. So if you don't have insurance, Dr. Brown, you know, she has Regional Health Commission. We have resources through Regional Health Commission. If you have insurance, don't hesitate to reach out to whatever the entity is that you use as your primary care source to ask for help.
Thank you. Yes. So can you each share what you surmise is top, you know, and what you're hearing from the community as the top 3 primary threats of COVID-19 in Black communities reentry? You know, with the city and the state opening up, our country opening up, what are some things that you know, we should be doing to prepare to survive, you know, with the reentry plan? And can you share what you know about the reentry plan?
The first thing I would tell people is do not let your guard down. Just because the economy is reopening does not mean that that COVID-19 is not out and still spreadable. We did not do testing the way that I feel like we should have. In a prior life, I have a master's in health administration. So, you know, my epidemiological training tells me that we did not do a good job in the United States at isolating this disease and tracking it. So as the economy starts to reopen, I think it's very important for people to still remain vigilant as though we are still at March 16th or 17th, and that it is spread, and assume that it is spreading rampantly, and still do the things that we instructed people to do back in March, which is maintain social distancing, make sure that the elderly in your family are taken care of, and keep them away from vulnerable situations. Wear your mask in public, wash your hands frequently. So we need to make sure that we are still operating as though the virus is everywhere and anybody can still get it. I think that's the most important thing that we need to tell people right now.
One of the things that I always share with my patients, and you know, one of the beauties of having this Black cultural background is that we are a resilient people, and when we're faced with something like this, sometimes we have to take it back to the basics. And I often tell my people, okay, remember, focus on things like nutrition and self-care. Make sure, you know, many times access to good food isn't always easy, but maybe that's an opportunity. I hear in the news, some people are gardening more, but you can go to inexpensive stores and get fruit and vegetables, even if you get them frozen. Focus on things like nourishing yourself. Use this as an opportunity to cook more at home. I am always taken aback when I call patients and I have a televisit. One of the things we expect people to do is maybe take their own temperature, maybe take their own blood pressure, check their own blood sugars. There are glucometers out there. Some of the local supermarkets sell glucometers for $10. If you're diabetic, you can test your own blood sugars. You can take your own temperatures. I was in Aldi the other day and I found a little wrist blood pressure cup. I think it was in the $20 or so. You can measure your own blood pressure. Take it back to the basics. Do what you can for yourself in terms of self-care. Remember, I tell my patients often that you are your first doctor. Take care of yourself first. And then on the other end of that, though, don't forget to use the technology you have. Again, People's Health Centers, most health entities in this area have electronic health records. Two of our largest health entities, and I'm sure SSM and BJC both have the same sort of medical record. I have an app for Epic Health, electronic health record on my cell phone because I'm a patient in those systems. You can get apps for whatever healthcare provider that you're seeing. You can get apps where you can access your health records so you're not wondering, gee, what were my test results? What did that doctor tell me at that last visit? You can actually access your health record yourself. Those apps are, they're inexpensive or free. I'm not sure if that app is free necessarily, but you can get those things fairly inexpensively. Download them on your cell phone, even if you don't have a computer and internet at home. Most people, young people included, have a smartphone or have access to a smartphone. Someone in the house has a smartphone. Don't forget to use your technology to help yourself.
And I definitely echo what the first two ladies said, and just wanted to add your mental health is definitely important. I must mention I have a toddler at home, so having to work and also try to figure out activities has definitely been a challenge and a new norm in learning for myself, and definitely has increased my appreciation of the daycare worker and teachers. But just understanding that to be stressed and to have mental health and, turn into substances and other things that you may encounter during this time is normal, but to be sure that you reach out when you're not feeling like yourselves as much as possible. And recognizing just because you're social distancing doesn't mean that you have to not interact with your friends and family. So as Dr. Boykin-Wright said, technology, reaching out to family and friends in different ways, having more virtual dates, or brunches with friends, just to make sure that you're having some sanity for those who are home by themselves, or are definitely extroverts who need that interaction and play, so that you can have some sanity during this time, because we understand that mental health is definitely a piece of what people are experiencing in terms of loss and grief in so many ways, and we want to make sure that we all come out of this at least with some support, and definitely getting support during this crisis is very important. But I'll add.
This has been just so informative. I'd like to ask all of our participants to remember to follow us on Facebook and on Twitter. And what we'll do is we've got some questions that we're getting a little long in our time. We'll have some questions for the panelists that we'll get some resources to add to our Facebook. One question was about how we're supporting the homeless. And another was, which you spoke somewhat about, Angela, was our frontline workers. There's a great regard for our doctors and our nurses that, I see as champions, but also those who support the doctors and the nurses, the cooks, the ones who support us with getting takeout food, the store clerk, all of those workers are, in most instances, Black and underserved, and they are also in need of being seen as our local heroes and some protection. So we will, the questions that we did not get to, we'll get some insight from our panelists and look to post those on our Facebook and Twitter feed. And ladies, in closing, is there anything else you'd like to share?
I did want to add that Medicaid expansion will be on the ballot in August. So definitely want to start spreading the word to go out and vote. To really, healthcare is definitely needed in our community. It really, out of I'm not sure how I'm voting, but definitely if there's a way to get your voice heard, please do so.
That's great. We'll also add something about voter registration, and we're asking for our participants to support us with a survey so that we can know what's important to you and how our delivery is, as well as to have a good stream of communication with our Facebook and live participants. This has been educational for me, and I'm just thrilled that we have people like you guys in our community championing and advocating on our behalf. And I wish you guys good health. I wish you progress. And you've been tagged. Thank you for joining us.
Thank you.
Thank you for having me.
Thank you. This is great.